Welcome back to the Practical Behavioral Care Podcast. Before we get started, I want to share a quick reminder that this podcast is for educational and informational purposes only. It is not intended to provide medical advice, diagnosis, or treatment. If you or someone you care about has concerns about mental health, please seek guidance from a qualified healthcare provider. Today, we're talking about something that's incredibly important: recognizing the early signs of schizophrenia. This is a condition that most often begins in the late teens through the early 30s. And one of the most powerful factors influencing long-term outcomes is how early treatment begins. For families, friends, teachers, and even coworkers, those early changes can be subtle and easy to overlook. They might look like stress, burnout, personality changes, or just a difficult phase. But noticing these shifts early and responding with care and support can make a real, measurable difference in someone's life. Early intervention often means better symptom management, improved daily functioning, and a stronger path forward. Let's start by talking about what clinicians call the prodromal phase, the early period before more obvious symptoms appear. This is often when the first warning signs show up. One of the most common early signs is social withdrawal. Someone who was once engaged may begin pulling away from friends and family, skipping social activities, losing interest in hobbies, or spending long periods alone. Invitations might be declined, texts go unanswered, and relationships quietly fade. These changes are often dismissed as normal isolation or stress, but they frequently come before more visible symptoms. Another early indicator is a noticeable decline in school or work performance. A person may struggle to concentrate, forget deadlines, have difficulty completing tasks, or appear unfocused during conversations. From the outside, this can look like a lack of motivation or effort, but in reality, these challenges are often linked to neurological changes that interfere with thinking, memory, and organization. Changes in thinking can also emerge early on. This might show up as forgetfulness, difficulty organizing thoughts, slowed processing, or speech that feels unusual or hard to follow. Someone may jump between ideas, struggle to explain themselves clearly, or make statements that seem confusing. These cognitive shifts can affect communication, decision-making, and confidence. Emotional changes are another important sign to watch for. A person might show reduced emotional expression, limited facial reactions, or appear emotionally flat. Others may experience sudden mood changes, increased irritability, or difficulty expressing feelings. These emotional shifts are often subtle, and they're sometimes misinterpreted as moodiness or personality changes, but they can be meaningful indicators. Some people also experience early sensory changes or increased suspicion before full hallucinations or fixed illusions develop. Someone might say that things feel off, mishear sounds, feel unusually watched or judged, or become more anxious and suspicious than usual. These experiences can feel unsettling and often intensify without treatment. So, what can families and loved ones do when they notice several of these changes? The most important step is to approach the person with compassion and without judgment. Avoid confrontation or criticism, and instead express concern in a calm, supportive way. Encourage them to speak with a mental health professional, and offer practical help, like finding a provider, scheduling an appointment, or going with them for support. It can also be helpful to keep a simple record of changes you've noticed, including when they started and how they've progressed. This information can be incredibly valuable for clinicians. Early intervention programs, often called EIP services, are specifically designed to support people during these early stages. And research consistently shows that early treatment leads to better outcomes. I want to close with this. Early signs of schizophrenia can feel confusing, frightening, and overwhelming, both for the person experiencing them and for those who care about them. But recognizing these signs early gives everyone involved the best possible chance for a positive path forward. Compassion, awareness, and timely care truly matter. And reaching out for help is not a failure. It's a powerful first step toward stability, understanding, and hope. If you or someone you care about is struggling, reaching out to a qualified mental health professional is an important first step. Thank you for spending your time with us here on the Practical Behavioral Care Podcast. Until next time, take care of yourself and each other.